Awesome.
Okay, thank you. Thank you very much, Mary. Thank you very much for the invitation. Actually, opportunities like this are really important for people like me, researchers that are at the earlier stages of their career, to present and get some feedback, which is very necessary. Also, thank you very much to those of you who attended, and even also those of you that are watching this in a recorded version, right? This is a paper that is part of my PhD thesis. It's studying the European response to the Ebola outbreak that took place between 2014 2016 in West Africa. Okay, so let's just get started with basically the main concern of this paper is the articulation of the European Union response to this incident, right? This incident belongs to a particular category of crises, right? It's a transboundary crisis in the sense that the Ebola outbreak affected more than one country. I mean, its epicenter, I mean, the countries that were most heavily hit were three West African countries, namely Guinea, Sierra Leone, and Liberia. It also disrupted several policy sectors, not only public health, but also trade, for example, tourism, and required an immediate response in conditions of very high uncertainty, right? But it's not only a transboundary crisis, it's also external in the sense that it had an epicenter outside of the EU borders. So it demanded still an European response, and it was a threat, perceived as a threat to the European Union at some point in the incident, right? And therefore, the EU response required some form of coordination between EU and non-EU countries. This is, by the way, the focus of my PhD thesis. It's a study of the responses to several crises with an external origin, right? But in this particular case, it's a really relevant study in the sense that there has been a lot of literature analyzing the overall response to the Ebola outbreak, some case studies concerning the role of different organizations, but very few analysis of a more holistic European response to this event, right? It's also interesting to have a look at coordination between EU and non-EU actors for crisis management purposes, but also in light of the COVID pandemic, of course, it is worth going back and having a look at previous experiences, right? In this particular case, it was an unprecedented occasion in the sense of the salience that this event had, even though it had an external origin, right? In order to test to what extent the EU infrastructure that was designed to respond to outbreaks beyond its borders had the ability to produce a rapid and effective response, right? And this, of course, currently is a higher priority. In the post-COVID era, it will be hopefully a higher priority, like the response to pandemics overseas. So it's worth to have a look at what worked, what didn't work, and hopefully extract some lessons for the future, right? So firstly, what the paper does, it reviews the evolution of the public health competencies granted to the European Union, right? For the first time, the Treaty of Maastricht in 1993, it gave competencies to the supranational level, to the European Union to handle public health matters, right? And since then, there have been a series of structures put in place that have been designed to fight, communicable diseases. Examples of these are the civil protection mechanism, disease surveillance system, early warning and response system. It's interesting that the set in motion of the European Centre for Disease Control. It's an EU agency that initially was designed in order to prevent the spread of any disease and assess risks of diseases spreading in. but here it had some role as well, even if the pandemic was located overseas. And also regarding the control of outbreaks beyond the EU borders, there is this crisis response system within the European External Action Service, right? And two departments within Directorate Generals within the European Commission, namely DG ECHO and DG DEFCO, that have competencies to, at least help in these response efforts overseas, especially DEFCO in developing countries would have a relevant role here. So over time, there was a realization that the European Union did not have a coherent position, right, when it comes to public health globally, right? So in this line, the document, the Council conclusions in 2010 was a turning point that provided a roadmap for future action in the sector, right? Including an explicit commitment, this is relevant for this case, for the EU to support developing countries against, potentially global threats. So after this, I mean, in cooperation with non-EU actors increased, right, the presence of European actors in the global health initiative, right, and also the growing role of the European Union in the negotiation of international public health agreements, and this also over time, there were more resources devoted to prevent the spread of diseases in regions that perhaps didn't have the capacity to respond to such incidents by themselves, right? So after, for example, the avian flu in South and Southeast Asia, there was greater funding in order to prevent such kinds of events from happening in the future, right? However, there is a debate, right, as to whether this increase in the empowerment of at the supranational level is enough, in the sense that there is this approach of normative power Europe, right, which would, in the case of external pandemics, expect the European Union to respond extensively to pandemics abroad, and at least to project the same values that inspired its foreign development aid programs, right? Or whether actually the reality is more in line with decreasing role in global governance, right? So this paper attempts to contribute to such debates by arguing that there are two circumstances of certain external outbreaks that make it more difficult for the European Union to become a central power in the response to such incidents, right? And these two are the potential of an outbreak to become a global crisis, right? Because this will lead to the involvement of non-EU governmental and non-governmental actors that have the ability to mobilize relatively large amounts of resources in a very rapid manner. Because, the main issue here is that the European Union is a very complex structure, right? It has some multi-level dynamics that sometimes could complicate the process, right, of responding rapidly and efficiently. And I'm talking about tensions between the Commission, for example, that is, gaining competences over time and has a federalizing ambition, right? But this collides a little bit with the reluctance of the member states, right, to relinquish sovereignty. So this nature, right, of the policymaking process results in some delayed responses, right? In the past, there have been reports of problems between the member states, or even between the member states and supranational institutions to coordinate. Also, there has been room for improvement when it comes to the communication with the WHO Europe. So this is something that plays perhaps against the European Union maybe responding as rapidly as some scholars would have elected to respond, right? So the second circumstance that plays against rapid and effective involvement of the European Union is the fact that some outbreaks are simply located in regions where the European Union doesn't have as much influence, right? For example, in this case, we are talking about an outbreak that affected primarily 3 West African regions that were not very socialized within the European Union fabric, right? And this complicates, the fact that the European Union finds it harder perhaps to lead a response that is met as legitimate, right, or understood as legitimate by even local citizens, right? It's also harder for the European Union to mobilize, to pool resources domestically in order to tackle a pandemic that is not necessarily an outbreak that is not necessarily salient, right? And therefore, it's harder to find why it's necessary to invest in tackling a pandemic that is in a region that will never reach Europe, for example, right? So it's a little bit harder in this regard. Indeed, when it comes to crisis management protocols, we have a lot when it comes to threats, internal threats affecting the European Union, right? But there is less anticipation of, potential risks abroad that might have a potential to reach Europe, but are still quite distant. So protocols to handle such risks at that early stage are really rare. And finally, we've got the component of the geographical distance, which makes it harder for example, European Union actors or crisis managers to be present, right, at the same time on site, and this could, lead to information asymmetries, which could be detrimental for an effective management of an outbreak of these characteristics. So. Here, in order to, I'm going over the methodology of the study. What did I do exactly to analyze this crisis? What I used is a methodology called social network analysis, which basically you will see it will present a graph, right? Noting the interactions between the different actors that manage the outbreak. It's a sort of a map, right, of this. It's a really interesting perspective because it lays emphasis on the ties between the different actors, right? Where are the relations between the different crisis managers? It has a more systemic view, right? We have a look at the overall crisis network, and we can even have a focus a little bit, zoom in the integration of the European actors there, right? It produces very rich empirical evidence in this regard. You will see it later, but also not just about formal interactions, right? And in crisis, it's really important to take into account decisions that are made in informal channels. Sometimes it's necessary to respond quickly, and this is something that social network analysis could record. And also, you, for example, could have a look at less obvious aspects, structural aspects. For example, presence of, the coordination of the response. If we have a look at, for example, cliques, which are defined as small graphs where everyone is connected to one another, right? Every member of the graph is connected to the other members of the graph. So if we have a look at structures like this, we can see, okay, so European Union actors were actually present in this sort of very cohesive structures, or no, actually we were missing here some protagonism of European actors, right? So this might not seem as obvious, and patterns like this could appear by having a look at the issue from a network perspective, right? So I constructed this network by distributing a survey among high-rank individuals that were involved in 50 organizations that managed the outbreak, right? In order to build the network, I was asking them, who were you in touch with during the crisis? How often did you monitor the actions of these institutions? And how relevant did you perceive these institutions to perceive? This is interesting to evaluate the weight of each of the actors present in their response, but also to have a look at the primary partners, right? Who they were in touch with and what their coordination was like in this particular effort, right? But of course, we have to pay attention to some aspects, right? Because we have to be very clear as to whom we include in the network. It was decided to include a rather small amount of nodes, around 50 actors, right, in order to keep an image, right, that is clear visually and allow us to extract conclusions as well, not only by having a look at maybe indicators, but also the graph itself. If we end up with 400 nodes, we might even a bit lose the point. So it was decided to keep it to 50 actors. This list was carried out by having a look at the academic literature, which is very rich on this episode, but also by speaking to experts on the field to ask them if anyone was missing. Also, by the way, the crisis managers themselves that responded to the survey had the option to say if someone was missing, any actor was missing. But finally, the final sample was reduced to 48 organizations because it was decided to remove 2 of them that were identified by not high enough amount of actors. And from these 48 organizations, there are responses from 42. So the social network analysis is very sensitive to missing values, right? But 42 from 48, especially considering that none of the 6 missing actors are European, it's already a relatively solid figure in order to extract some conclusions. Even though 6 actors will not appear in the network, the final graph will only picture 42. There are graphs with some indicators regarding the centrality, who is more or less relevant, that where the 48 organizations will appear, because these indicators are basically given, so to say, by other actors and not themselves, right? So that's why we have these 48 actors in the table, but only 42 in the network. So regarding, I mean, of course, there's also another caveat that has to be taken into account, which is that, I mean, there might be concerns when it comes to the validity of the data, because we're here relying on subjective perceptions, right, of individuals. But I mean, we, for example, might not be fully aware of who their organization is in touch with during the crisis, right? Because the organization is really large and they might not know everything. But the approach that was taken was basically trying to address the highest possible ranking individuals in the organizations, and this was indeed actually possible. In very few occasions, I had to reach someone that was in a lower end of the hierarchy, but most of the cases we had the highest ranked individuals within each organization responding to the survey, which was really a success. Also, I had a look at documents at different minutes of meetings, right, where, you know, for example, assistance to high-level meetings was reported, to see, I mean, who was in touch with whom during these meetings, and maybe compare this data with my own network in order to assess to what extent the responses I got were valid. And I have to say that over 90% of the ties that I found, I mean, in this by having a look at these documents, were confirmed by at least one actor in the network. And 40% of these were identified by both ends. And this is interesting as well, because the fact that only one end of the tie is responding, this already might be indicating that there is some degree of hierarchy, right? In the sense that the highest node in the hierarchy might be remembered, is more likely to be remembered by the lower end than the opposite way. So this is quite interesting. So there is also, besides the network itself, I also carried out interviews with 14 of these crisis managers. Details about their affiliations are not fully disclosed in order to preserve the anonymity of the respondents, because again, the high profile of these respondents forced me to do that, because otherwise they wouldn't agree to respond to me. But still, you've got a list at the end of the paper, an annex, with some at least some details regarding their affiliation, which institution, and a very quite, it's true that it's quite vague description of who they were, but at least you've got some information there. And let's go to the empirical part of the article, right? So here we see the network, the graph itself, right? You can see that different nodes, according to the nature, are classified in different shapes, right? So European actors would have a squared shape. For example, UN organizations would be circular, right? I mean, international organizations would be circles. So the African governments, which were quite relevant, have a triangle, etc., etc. From having a look at this visual image, we already can see that the nodes that are occupying the most central positions are perhaps international organizations, some NGOs such as MSF or even Red Cross, and less so the case of European actors, right? And especially when we take into account the node sizes, which represent how relevant they were perceived to be by other actors. European supranational actors especially don't perform as well as the above mentioned NGO actors and international organizations, perhaps with the exception of the UK DFID. That's perhaps the only exception in this regard. Just to say that centrality means who they were in touch with. The more actors you were, the more central, the more actors you are connected with, the more central you are. Also, the more connected the actors that you're connected with, also that makes you more influential, right? So centrality is also an indicator of influence, not only perceptions of influence by other actors themselves, right? So on the other hand, we've got private actors that are occupying very peripheral positions, also very small node sizes. Most NGOs, apart from perhaps the International Federation of Red Cross and the Red Crescent Movement and MSF, apart from these two, all other NGOs are more peripheral as well. And we can see how the African governments themselves were quite central and quite relevant. And the response indeed was carried out according to a rather post-colonial logic. For example, the UK was the most involved foreign power in Sierra Leone for sure, and the United States as well in Liberia. But this is less the case of France, for example, in Guinea, and this is already quite interesting. In fact, when I was doing some interviews, I recorded that France was present in the highest level meetings, but then they didn't work on the ground, or barely worked on the ground. So this is already quite interesting to see the difference comparatively between the US, the UK, and then France, maybe less relevant in the response. So here you've got some indicators regarding centrality, right? So degree, the first two columns, who are you in touch with? Closeness, how closely are you located to other actors in the network? How easily is it for you to reach others? And betweenness, how likely are you to be in the shortest path between two nodes? So in this sense, it's true that the European Commission and the European Ebola Coordinator perform a bit better in these indicators, right? Although they are not very relevant. And also they are present in some of the longest clicks, which I said, these structures that include actors that are connected with one another. However, despite these exceptions, because, at the end of the day, the Commission was present in highest level meetings, but it was not that much present on the ground either. And the Ebola Coordinator, it was regarded as an effective leader, but less so than his counterpart in the United States. And also he was appointed at a very late stage in the response, right? So indeed, we've got here evidence that the reaction of the European Union was quite slow, perhaps in line with many actors of the international community. That's very true, but it's also true that there is very room for improvement when it comes to the coordination of the European response. And we see that in the sense that there was little coordination among member state agencies, very few ties among member state agencies involved in the response, and also between these agencies and supranational institutions. Supranational institutions are not in general found very relevant. Also, member states, apart from the UK, are not really relevant in the response. Here we've got, here the numbers that you can find in the paper as well regarding the importance of each actor in the response, right? The European External Action Service, for example, was one of the first EU actors, only EU actors involved at the very earlier stages of the outbreak, and indeed was in charge of coordinating the EU response at that time. However, it was really not identified by many non-EU actors as a node that they were in touch with, right? Despite it reporting ties to many non-EU actors. So that's an indicator that perhaps it wasn't perceived as a very relevant node. The ECDC, there is a lot of literature here that supports what we see in the paper, that it's much less central than the US CDC. Of course, there is a huge difference in resources. Also, the ECDC lacked a mandate to intervene overseas, and that complicated a lot its involvement. Especially at the beginning, its role was limited to just assessing the risk of Ebola reaching Europe and providing some recommendations to other EU actors. The European Parliament is fairly relevant, and it was instrumental to draw attention among the EU citizenship about the need to intervene. And when we compare the role of the European Union to foreign powers such as the US, we see it as much less relevant. But when it comes to China and Cuba, we see that the influence is more or less the same. And I would stress the case of Cuba, right? How a country that is expected to not be as involved as a perhaps wealthier power such as the European Union is indeed perceived as very relevant. It actually sends many doctors to work on the ground. So at the end of the day, the conclusion of the article is that the European Union was less extensively involved than other governmental non-EU actors such as the United States, but also as other non-governmental actors. And only the DFID could be considered to be central in the response, or relatively central. But even the DFID was actually better connected with non-EU actors than with EU actors. So that's quite interesting. Of course, we're talking about 2014, 2016, pre-Brexit times, when the DFID was still, the UK was still a member state. That doesn't apply, anymore. But even that, there is a lot of room for improvement, as I said before, regarding the coordination of the European response. Having greater communication between European actors appears perhaps necessary for a more effective response. And there is evidence as well that the fact that the epicenter was located really far away from the EU borders played a role here, in the sense that the ECDC had no mandates to operate abroad. The operations conducted by the European Union or even other foreign actors were not legitimate. This complicated the response considerably, and also it was quite difficult for the European Union to respond quickly because of the need to convince funders that it was necessary to pull resources to combat this outbreak. So there is a reflection that I would like to end this presentation with, which is basically that the European Union is not prepared to respond rapidly and efficiently to outbreaks overseas that might have the potential to expand globally. And in the post-COVID era, it's necessary, I guess, to reflect on the need to offer early and efficient assistance to non-EU countries that might not have the capacity to respond to such incidents, and perhaps an empowerment of the European Centre of Disease Control could be a way forward in this regard. This is it. Here is the list of interviews that I was talking about before. You have it in the paper. So many thanks for being here, for listening to me. And I really look forward to your questions and comments. Thank you very much.
Okay, thank you, Carlos. I'll just stop recording.
Mm-hmm.